There should be a new diagnosis called COVID-19 trauma. Honestly, it wouldn't even be a big adjustment. It could be like a subset of PTSD. We could just slide it right into the DSM-5. Just like do edition number 13 or something. Just a quick revision. I always knew that COVID-19 was going to affect people, and I had an idea of what the trauma was going to look like on the other side of it. But being a therapist, and it's been a few years, people are still experiencing those traumas. They're still being triggered. The isolation that people endured, it's just saddening. It's really disheartening. Endured. I don't know why it sounds so weird. Am I just really Southern? Endured. It's really hard for me to explain trauma to someone who maybe has never experienced it, but I'm sure that everyone watching this, the majority of you have that feeling your body and your brain make of that fight or flight, immediately feeling like you're trapped or scared, you're anxious, your heart's beating, your hands might start sweating. It's just so many different things that can happen when you know that you've been triggered. The best way that I can explain trauma, and even being a therapist, I always tell people it's almost like the law of energy, how it cannot be created or destroyed. Energy has to go somewhere, and trauma is energy, and so is healing. So even when you go to a therapy session, or even if you're talking to a friend, you are getting that energy out, and it does go somewhere. So the person who's listening to it, they're probably going to absorb some of that energy, even if it's just a little bit. And it's one of the reasons why you feel relief after you've talked to someone about something. I guess I just made this video just to remind everyone to please be kind, because you don't know what the person next to you, what their battles are. The fact that people are still experiencing the feeling of loneliness and, again, isolation and sadness, the feeling that they're not important enough or that they're not being valued enough by the people who say that they care, because they are being left alone. They're not being checked on. Just please keep that in mind. If you've hung on to the end of this video, I appreciate you. I would love to know if anyone else has experienced any type of triggers or trauma after COVID-19, something that affects you even today that you might want to share. You just never know if someone else is going through that same thing that you are. Any tips would help.